Right. Welcome, everyone. I'm Sabreen Huck. I'm a Partnerships and Programs intern at the Coalition to Transform Advanced Care, or C-TAC. I'm currently a junior at Brandeis University, pursuing a bachelor's in science in public health and economics. My interest in health policy research and advocacy and education stems from, my academic and extracurricular experiences. In the past, I've worked as a research assistant at Columbia's Mailman School of Public Health. There, I studied the contemporary role of medical organizations in health policy today. And, in addition to my current role, as a lead researcher at Brandeis University's Heller School, there I've been working to assist my mentor in her upcoming book, which is focused on disparities in Black infant mortality rates in the US. And lastly, I'm also the founder of HealthBits, which is an interactive online public health news outlet seeking to bridge the gap in healthcare education on a range of topics for this generation students. And through my research experiences and my time at C-TAC, I've really learned that, advanced care planning and palliative care are areas of healthcare that have yet to really be explored to the fullest, especially among undergraduate students. So, I, like the folks that I'm joined by today, are eager to, rectify this gap in education and engagement. And, we're really passionate about bringing these, what seem to be, senior issues to a newer audience. And this generation, that being, this generation of college students who really at the end of the day will be the ones to shape policies in this field in the long run, as the next leaders in healthcare. So, it's that passion that, brings us to today's conversation that will be shared between C-TAC, HealthBits, and Koda Health's younger audience and network as the first of a series of fireside chats on student engagement. So, so they can see firsthand how students can, become leaders in advanced care planning. And, to me, I find that, the timing of this chat to be fitting amidst this, pandemic, where many of us have already witnessed, firsthand or secondhand, the impact of advanced care planning and its associated policies. And, from my own experience, I found that many of us are eager to now play a larger role in that. So to get down to our topic, today we'll be discussing the importance of student engagement in advanced care planning and how specifically undergraduate students can get more involved in this field. So today I'm joined by two colleagues from Koda Health, which is a fast-growing digital health startup and new member of C-TAC. But before we dive right in, if we can, have our guests kind of tell our audience a little bit about their work, their background, that'd be great. So Tatiana, do you want to start us off?
Yeah, absolutely. Hi, everyone. My name is Dr. Tatiana Fofanova. Quick aside to your introduction, Sabreen. I also spent some time at the Mailman School of Public Health doing novel pathogen discovery in one of their molecular biology laboratories. So it was a really fun time as an intern, actually.
Oh,
wow. That definitely impacted a good portion of my career. I went off to get my doctorate in molecular biology and molecular medicine, partially influenced by that fellowship or that internship. Since then, I've done a number of things, worked for some investment groups, worked as a writer, and eventually, along with my two co-founders, Dr. Dej Mohan and Caitlin Sherry, we founded Koda Health. And that really stemmed from our experiences in working in healthcare. So, I came from the therapeutic side, and really the more time I spent developing new drugs, the more I realized, spending time in the clinic, that most of the time you don't really need a new drug. Most people just need access to basic care and basic infrastructure, right? That moves the needle far more than any sort of novel biologic really ever could. And we spent 6 months in dedicated customer discovery as part of a fellowship at the Texas Medical Center that allowed us to passively and sort of without deep emotional involvement, observe how advanced care planning is conducted in primary care clinics, geriatric wards, trauma centers, in every possible venue. And the short answer is it wasn't. In 6 months of clinical observation for myself, and in many years of clinical practice for Dr. Mohan, our co-founder, not once was it brought up, right? We call it the elephant in the room when you're treating an older patient, right? And I think what the final sort of crystal in motivating the development of Koda for me was when I met a woman in the cancer ward of a hospital here in Houston who had been in and out of treatment for over 26 years. And she was obviously in a lot of pain. She was, suffering. And she was frankly begging to speak to anyone or someone about her end of life possibilities, right? Like what options are even out there for me? But no one wanted to listen to her because they thought she was too morose. Her husband didn't want to, he just couldn't handle it. And that's when most people first had this discussion is in palliative care, approaching hospice, when it's the most difficult thing you could possibly process. And we really just wanted to rectify that situation and bring it upstream, make it more accessible for physicians to engage in this, lower that barrier of engagement, make it a less scary process that is done by more people. And particularly because so few people have access to advanced care planning, it's usually done through, an estate planning attorney or to people who, have access to direct consumer solutions or can pay for things like that. And that's not most of the Medicare population. Most of them live at or below the poverty line. They don't really have an estate to plan. So there had to be a better way to deliver it. And so that's why we started Koda Health. We launched in March of 2020. And within the last year, I think have made pretty significant progress in building out the platform, in getting into patients' hands. We've served hundreds of patients so far here in Texas, and are trying to grow as quickly as possible, particularly in the shadow of this pandemic and the demand for advanced care planning that it has cultivated.
Yeah, and I'll go ahead and introduce myself. My name is Alyssa Martinez. I am one of the digital health interns at Koda Health, and I started last fall semester, fall 2020. And I am a senior corporate communications pre-med major at the University of Texas at Austin. And through my education, that's kind of where I was really made aware of the importance of communication in healthcare. A lot of people ask me like, oh, why did you choose communication if you're pre-med? And I think it was so interesting that so many people don't really realize how important communication is in healthcare. And I think through my education, I was really able to realize that and how much of a problem it is, especially in our healthcare, and how much it relates to medical mistakes and errors. So yeah, through my education, I became much more passionate about the role that healthcare and communication play together. And I've had the wonderful opportunity to be involved in Koda Health. And this, especially, well, my role is I've been able to translate the advanced care planning platform to the Spanish, which has been a wonderful opportunity just to kind of really help the Hispanic community, and which is a big health disparity for them, and having that language barrier is a big issue. I think I realized that last semester I stayed home during the pandemic, and I remember my mom having a conversation with one of her clients. She's an insurance agent. She just has all these conversations with people, and one of her clients ended up receiving COVID, and just talking about the story that he was so afraid to go to the hospital because he was scared that he wasn't going to be heard and he wouldn't make it out. And so realizing that and that impact of not having your voice heard in somewhere where that purpose is to take care of you and make sure you are getting the care you receive, that was just very okay, yeah, there's definitely a problem here. And I'm so thankful to be able to work with Koda and really make an impact. So
no, that's amazing. I mean, it's so nice to meet you, Alyssa. I think your experiences kind of say it all. And I think to your point about, communication and healthcare and the healthcare space, it's definitely something that's been lacking. And, to see, students like us really trying to rectify that is really important, which is why, this conversation is really to keep up that momentum and, get other students to get more involved in that space too. So no, it's such a pleasure to, have you both join us as part of this super important conversation. And just so we can get right into it, the format of our discussion today is just meant to be, like I mentioned, casual. We'll start off with a few questions, and the three of us can just, keep bouncing thoughts and questions off of each other to keep things flowing. If that sounds okay with you both, we can just get right into it.
Sounds great.
Awesome. Okay, so perfect. So just to start off, we can begin with more of an open-ended question, and that one being, to you, why is advanced care planning not just a senior issue?
Yeah, I can start with that, and I think my answer has a number of different reasons that it's not just a senior issue. The first being that the youth of today are going to be the caregivers of tomorrow, right? And so when it comes to advanced care planning, the most critical component isn't actually the senior or the person creating their own plan, figuring it out and putting it in a briefcase somewhere. It doesn't work, right? What does work is that person sharing their plan, sharing their wishes, starting that conversation with their loved ones, so that if and when they fall into that scenario of serious illness, their loved ones know what to do. In part because if the first time you, as the daughter or the granddaughter of one of your grandparents, right, sees a document where your grandmother or grandfather says, I want this, this, and that, if that's the first time you're seeing it and you never had this discussion, most people's gut response is, yeah, grandpa wouldn't say that, grandpa wouldn't want that, that's crazy, right? Because we don't communicate those components. There's lots of studies that show that when people just rely on sort of clinically unguided conversation between family members, next of kin are, the likelihood that next of kin choose what their loved one would have wanted in terms of healthcare preferences is less than 50%, right? So that conversation needs to be structured, needs to be guided, so that the people that are going to be doing the caregiving and making those decisions on behalf of their loved ones feel supported, feel structured, have that peace of mind knowing that the decision they're making, which are extremely difficult choices, are the things that their loved one actually wanted, right? And on the senior side, they get to maintain dignity and control over their healthcare journey throughout their life. So that's one core point. And another core point I will say is that advanced care planning is 1,000% not just for seriously ill people, right? It should be for anyone over the age of 18, because, heaven forbid, you go outside, you are hit by a bus and you go into a coma for 6 months, right? Terrible scenario, but still, just roll with me here. It's important for your family or your loved ones or whomever to be able to make those healthcare decisions for you. It's important to assign that medical decision maker, because in a lot of states, if one isn't assigned, the courts can actually tell or decide who will be making your medical decisions. And it might not be the person that you actually want, right, making those healthcare decisions. And particularly if you have specific choices or specific preferences about, your religion or your background or how you'd like to be treated or where you'd like to be, those all need to be voiced throughout at any point in your life.
I've definitely seen that difficult side firsthand. I mean, my mom's best friend passed away, I believe, 2 years ago, and she was the one having to make all those important decisions, and it was like every day was just a different stressful situation for her, and she constantly told me, I'm just so scared that I'm not doing what she would have wanted. And I think that really, for my whole family, was kind of like an eye-opening experience, and realizing it's really difficult and kind of awkward, but at the end of the day, it is so important to have that conversation, to start planning now, because God forbid you wouldn't want to have that worry of goodness, did I make the wrong decision, or what would they have wanted when it's already too late. So I definitely agree with everything that Tatiana explained.
Yeah, and clinically, we've seen families fall apart, right? Because families start to fight. They burn through all of their savings. It can be a traumatic experience in a number of different ways.
No, I completely agree with that. Something that I was just thinking about is, just learning how to, sit with your own discomfort, or even just be comfortable with, that sense of discomfort, isn't something that necessarily should be restricted to, restricted by age. And I think it's something that for many of us should be, we should be learning about how to do that at a much earlier age. And, like you mentioned, Alyssa, at the end of the day, we all experience firsthand, secondhand these type of experiences where, we find a loved one, trying to make these very difficult decisions. And in some cases, we ourselves, maybe amidst this pandemic, we've all experienced some form of, pain management, relief, and, learning how to alleviate this unnecessary suffering is something that in some capacity or the other, really, personally, I can say for myself, I've experienced that. And, for me, I also recently, had a loss in our family, and it kind of opened up these doors to all these questions. It became pretty chaotic because everyone was like, what's the right course of action? What treatment should we be giving them beforehand? Because we were kind of anticipating this would happen. But, it kind of showed me what, this field really does have to offer, and how much communication, how much value that really holds. And being able to direct, our loved ones, our friends, family, towards the care that they need. And, that's really going to be done by us, younger generation students. And that's why I just think it's so important for us, be aware of that now before, we wait till it's too late. Yeah, for sure. So, that kind of brings me to my next question, what role then can students, like ourselves, really play in this field? And, how can we get involved in this space, whether that be on our own campuses, in a more corporate setting or something like that. So, if you guys have any thoughts on how students like us can get more heavily involved, in advanced care planning, and, just demonstrate more engagement.
Mm-hmm. Alyssa, would you like to grab this one
Yeah,
first?
I can definitely start on this one. I think there's like many different ways to kind of break down this question, but I think first it starts with like taking advantage of your education and exploring what you are genuinely like passionate about. Because for me, I mean, making the switch into the communication side of things, I don't think I've ever would have realized like started to question our healthcare system as much as I did being exposed in these like interpersonal like communication courses and involving healthcare. So I think making sure to like continue to learn and continue to question the current healthcare system is kind of like the first thing, right? I think the second thing is exploring your passions and strengths and how you can use them to make an impact. For me, after I kind of like realized how much a big role of communication was, and especially for the Hispanic community, finding the opportunity in Koda Health to help them like directly by making this platform into Spanish, I think was really special to me, and realizing like how important that was. So I think finding whether that's you enjoy the digital side of things, you enjoy the advertising side of things, the marketing side of things, finding those special like passions or interests that you have and how you can use that to make an impact, I think is so special, because at the end of the day, you do not have to think you have to be a doctor to make an impact. And I think that's one of the biggest things I realized. I felt like, okay, well, I know this is such a big deal and I want to make an impact. Well, okay, I want to be a doctor. And yeah, I do. I hope to be able to make it into med school and one day be this great doctor that I can use all that I've learned throughout the years of the importance of all these different values in healthcare. But at the end of the day, I branched out because I realized, this isn't just the way a doctor operates or provides care. This is a systematic issue. And so being involved in these companies, these organizations, even in our local and state government, finding opportunities to get involved, whether that's an internship or attending a town hall or something like that. I think that there's so many different avenues you can go to make an impact in healthcare that does not just need to be I need to be a doctor to make something happen. And that's one of the biggest things I've learned.
Man, I am so excited and proud to hear you say that. No, I'm serious. When I think about sort of the contribution that Alyssa made to Koda, I get shivers every single time, right? Because it is, we live and are currently operating principally in Texas. So a lot of the population is Spanish speaking only, right? And most of the time, physicians only bring in translators for really critical things. And unfortunately, this is something that's not often viewed as critical, right? As a critical discussion. And so it's a huge value add for us, right? And to your point about not needing to be a doctor to make an impact, right? First of all, they generally don't teach this stuff in medical school, right? You have to go on to become a palliative care fellow in order to learn how to have these conversations, right? And so most physicians will never learn this skill set, right? It's one of the reasons we're trying to reach out to as many students as possible to, really change things at the roots, right? Before everyone goes out, and hopefully you guys go and create programs in your medical schools, your graduate schools, your anywhere you go, really, that change the narrative in this conversation. But Alyssa really hit the nail on the head. You don't need to be a healthcare professional, right? The type of people that hold most of the roles within Koda are not doctors, right? We have salespeople, we have UX UI designers, we have vocal talent. Like there's so many different things that you can do that have this far-ranging impact. When you're speaking to a patient, you can impact one person, one family at a time. When you're working on a startup, for example, or like a policy, what you're doing is creating a product or a process that systemically changes the way people operate and can impact hundreds and thousands of people daily. And that ripple effect is monumental.
No, I completely agree, especially, with that. I think the idea of, having to be a healthcare professional or a doctor is something that it's a common misinterpretation, misconception, or surrounding, any aspect of the healthcare industry, at least from, what I've seen. And I think the best way, for college students like us, and this is something that I've been personally trying to work on a lot more, is really just tapping into my own, network, my own professors, my own, friend groups at schools. And really just, because the interest is there, I just don't think, people necessarily know that, this is an area of healthcare that they can really get into. And, something that I've been trying to do, and I'd really encourage, other students also, is, like I mentioned, just reach out to professors, whether they be, working in palliative care or not, but they're always going to want to, encourage students to learn more about, any area of healthcare, including this one. And set up a chat. So something that Brandeis likes to call these coffee mug chats. So engaging in an informal conversation similar to this one today, with a professor and a group of students, just about a topic of interest. And I think having things like that, just starting them, like you mentioned, Tatiana, at that root level, is really what's going to help take this conversation further, and maybe start implementing changes in medical schools so that students actually can learn about it without having to ask to learn about it.
Mm-hmm.
And I'd really just encourage students to really start where in your own kind of niche with your own professors, and take it from there. As long as you can establish that interest, get conversations going, thoughts rolling, that's kind of really where it all begins. So no, I really,
and honestly, even if you don't pursue the traditional sort of professional ways of getting involved through internships or fellowships, whatever it might be, just going and thinking about these things and talking to your parents about them already makes an impact, right, within you and your own family. But it starts everyone off on the right foot. Like I know that, for example, one of the biggest benefits for me in founding Koda has not been the hyper growth of a company, right? It has been me being able to have these conversations with my father, right? And my father's advanced care plan prior to launching Koda was, yeah, just leave me out by the lake and I'll handle it from there. Like, what is that supposed to mean? I'm pretty sure that's illegal. Like, I can't do that. And if we can help just a few people in our run, it's worth it.
Right. No, I completely agree with that. I think, keeping up with this momentum, one question that I also had, for, Alyssa, you and I, given both of us being, interns in different, parts of the advanced illness field, how do you, see yourself applying, what you've learned at Koda Health into your professional or academic, atmosphere? I know you touched on it, but, I'd love to hear a little bit more about that.
Yeah, I definitely think that I've learned what like patient-centered care looks like and the true value of providing care to someone, and why like I would want to be a doctor in the first place, or whatever impact I would like to make. So I think in this like internship, really understanding like what the impact that I've done, especially for the Hispanic community, and what good care looks like, and the care that I would hope my family receives, my friends receive, and that I hope I can like make an impact and provide to the future patients I have. And I think just also being able to continue to spark that conversation, like I mean, we've all said this entire time, to I mean, even with my own family, like one day at dinner, I would just kind of spark the conversation, like what would like not having something in your life, like what is not worth living anymore, like whether that's if you can't drive for some people, or like would you still like what would that mean for you, or if you had to have help eating, like would that still mean a good quality life for you? So I think even these smaller ways to have this kind of informal conversation where it doesn't have to be like what do you want if like something horrible were to happen to you. No, it's just like what are important values in your life, and what does that mean to you? So I think that's another important way to have like this, like still make it not as intimidating of a conversation, but for somebody like I would, it would mean like not being able to read. I would not want to, like I couldn't live without being able to read, like that kind of thing. And just truly valuing like the value of a person and the value of life, and having the opportunity to make sure that everybody has the life, I mean, that they deserve. I think that it's just kind of to sum it all up.
And what's sort of as an anecdote to accompany that, what's funny is I've had these conversations with so many people. I've had advanced care planning and quality of life and goal concordant care conversations with hundreds and hundreds of people. And most of them, when you're walking them through this, their response is, well, of course I would want all of the care, and who would want to, or like who would want to be on a feeding tube, right? And their perspective is that of, this is the obvious choice, right? But it turns out there's a whole slew of preferences, whole slew of how people define quality of life. It is different for every single person, and every single person thinks that their perspective is the obvious one, right? But it's not obvious. Even within your own family, it's not obvious, right? But I've also seen situations where an advanced care plan has gone beautifully well, right? And I met this one woman who had an advanced care plan for her father, but not for her mother, because her mother was 15 years younger than her father. Her mother passed away suddenly from an aneurysm on like cooking dinner, and was on life support for a long time. It was a wreck. It drained her savings. It was just really painful. And her father he passed away very slowly from Alzheimer's. But and the story she told me was really beautiful, because she knew that what was important to him was being able to eat. Like the day he couldn't eat ice cream was the day that was very specific, was the day that he didn't want to be around anymore. He didn't care if his brain had gone. He didn't care if he could move around. Like ice cream was really important to him. And so he spent his last couple of months eating Klondike bars, happy as a clam. right? And it was just this transformative experience for their whole family, to know that meant so much to him.
No, that's such an interesting story. I actually have, something very similar to that, from my own family. My grandfather was also very into, food being, the last thing he wants to, that's the first thing he wants to do in the day, the last thing, he wants to do at the end. And, that still, came to be, when he was reaching that time where, he just didn't find that life was really worth living, to the point where he couldn't enjoy some of his favorite foods. And for many of us, especially myself, being pretty naive to that concept of, oh, he doesn't want to live, like that's crazy, right? But just being able to understand and have that sense of, okay, maybe this is, the right course of action. This is something that is important to this person. This is how they want to, depart. And I think that was, my first kind of look into, having these difficult conversations, which, for younger students, and at the time when I was pretty young, to be very, discomforting, and something that, oh, I don't want to even think about, life, death. But, and I think, having that firsthand experience, seeing, you know, um, my grandfather, at that point in his life where it didn't seem like it was worth it. And then seeing my, parents trying to, convince him that no, keep holding on. But that whole process is something that, students like us, I don't think really value to the extent that, maybe we should be, because it's a critical, component of that, end of life stage. And it's just interesting. Yeah.
Honestly, it's a critical component outside of the end of life stage, right? If you know what your quality of life preferences and your goals are, you can choose treatments that maximize for the quality of your life, right? You don't have to be at the end of life to do that, right? People do this instinctively when they look at the side effect label on various drugs, right? They read the side effect labels and it said you're going to be nauseous and vomiting from this drug, but it'll help you, I don't know, walk 30 feet farther, right? People already instinctively make these calculations, right? And if we can move that upstream and encourage more people to identify what is important to them, what functionality is important to them, they can start making healthcare decisions that they can stick to, right? That improve their lives overall.
No, I definitely agree with that for sure. And one kind of last question that I had for you, Tatiana, was, while we're in this, period of this pandemic, and I think a lot of these, terms are becoming normalized, especially with regards to, advanced care planning, this kind of cultural shift we're in. I was just curious, why do you think, student engagement, especially now in this period, is of utmost importance, especially, for college students like ourselves?
Well, I think in some ways that's a loaded question. There's so many answers, right? My first gut instinct feeling is we've all been separated from each other for a long time, right? And I can't tell you how wonderful it is to speak to a senior, for example, about this, and for them to see that you care, right? And to see that young people care about them, right? Because there's this massive communication divide amongst the generations right now. And we need to care about each other, right? The young need to care about the older, and the older need to care about the younger. And I think it's critical to us moving forward as a society from a historical mega event that is so just emotionally and internally painful, right? So on a personal side, I think that is a critical component. But on the professional side, this is a kind of a happening field, honestly, right? There are so many people aging into the Medicare population that the Medicare coffers can't support it, right? Which means the American taxpayers are supporting it, right? And more caregivers or more and more people are transitioning into the caregiver role, where they're going to have to take care of their families. And so it's it's becoming a financial problem that is causing the field of innovation around it to really explode, right? It's the influx of people aging into the Medicare population is known as the silver tsunami, and innovations are popping up left, right, and center. Regulations are changing, right? The pandemic has changed the way people navigate technology, right? People who never even knew what Zoom was. I helped an 84-year-old download Zoom the other day, right? She uses it now, right? There are all these changes that are happening that make this a phenomenal time to innovate and to really set the standard for communication in the future. So while we're all in this frenzy, there is a period of, for lack of a better word, post-traumatic growth before everything settles back in, that we can really shake things up, that we can change the way people navigate healthcare in the future. So, and to do that, we need fresh ideas, right? We need people who are hungry and ready to work and are passionate, and we need to empower students to do that, right? Because on top of that, the pandemic has been really painful for students and their job prospects. So I really think, you know, all the stakeholders are aligned in this sort of scenario where students are eager, they're hungry, they want to get involved, they should be communicating with older folks. And it's a wave of technological innovation that is not going to stop in the next couple of years, you know?
Yeah, I mean, I completely agree. I think that goes to kind of prove that whole point where, you know, despite COVID-19 kind of pushing us all in our homes, kind of distancing ourselves, it comes with the, you know, that side where it gives us that chance to explore different avenues of healthcare and kind of take our education, our learning experiences into our own hands. I mean, that's kind of what happened to me. You know, HealthBits really did come about from, you know, sitting at home, kind of questioning, you know, the policies that exist today in the healthcare system, you know, just some gaps that I found. And, you know, I feel that it really just comes from, you know, spending some time just with your own thoughts, seeing, you know, where you can kind of get involved in any way you can. And that's why I think, you know, this time is so, you know, precious in terms of doing that, which is why,
Yeah,
yeah.
I think that's like one of the biggest takeaways like us as students can take is to challenge like the tradition, I guess, of like even for someone like as a medical student, like we talked about, like the conversation and like learning of care and like communication aspect isn't isn't really talked about very much, and that sort of education of the role of communication isn't really there as well. So I think if we just start to question our like our education and what we and the healthcare system and how we can really explore different ways of learning, whether it's like our own passions or learning about like what issues there are, and continuing to take advantage of this opportunity to learn as much as we can and soak it all in and really learn the true values that are there that I don't think is normally talked about just in like the STEM classes or in the medical school. Like really taking advantage of all the education that's out there and realizing the bigger education in like the actual values of the healthcare system, I think is where we're going to make the biggest impact.
And pandemic is really the great equalizer. I have never met Alyssa in person.
Yeah.
Right? We've got
Yeah.
interns in California and Canada, right? It doesn't matter where you are anymore. You can have that impact from your kitchen counter. And I think it's become more normalized to do so.
Yeah.
Definitely. No, I think just so we can kind of keep up that momentum to kind of close out our conversation, I thought, you know, we could talk about, you know, a few questions that were actually sent in by some, you know, fellow university peers from Brandeis of mine. And, you know, we can all kind of chime in for those and just kind of talk those out, if that sounds okay.
Sounds great.
Great. So, you know, one question, and I know we've kind of touched on a lot of these things, but I thought, you know, just to wrap up, kind of recap, the first question was, you know, if our schools don't talk about, you know, advanced care planning much as a topic in healthcare for us to pursue, you know, what are some ways for us to familiarize ourselves with this field?
I think we have the great Google and the great there's so many websites now that we can like you can quickly just Google it and really soak in and kind of take advantage to spend time to learn it yourself and then really question what that what I'm sorry what passion and like what values come with that. So not even like, okay, learning what it is and learning the issues with it, but okay, taking it one step further and now how can I challenge my own education and my own interests into making a difference and making an impact from there is where I would start.
And where I would add on to that is, I will say that the palliative care, serious illness, advanced illness community is the most friendly healthcare community I have ever worked with. And I've worked in pediatrics for a number of years, right? They are so eager to change the conversation, to change the narrative, that you can reach out to anyone and they will take your call and they will talk to you, right? And I think one thing that I didn't know I could do when I was an undergrad is I didn't know I could email important people, right? And you can, right? You might have to email 10 of them to get one response, but okay, that's 9 emails that you spent writing, no big deal, right? But you can create a really fantastic network. You can reach out to organizations like C-TAC and they'll put you in touch with as many people as you want, because at the end of the day, what matters is interest and passion, right? Skill sets are picked up. You know, interest and passion can't really be learned.
Yeah, no, I think, to your point of networking, I think for me, specifically, I came to C-TAC really because of the strong student network of alumni that kind of exists at Brandeis. And, I realized from hearing about, their experiences and their time, it was like, wow, I honestly had no idea what advanced care planning really entailed, really beyond a nursing home, if I'm being honest.
Mm-hmm.
So, I kind of took that as a chance for me to explore that even further. And, like you both mentioned, it really comes down to, being inquisitive, being curious, typing a question into Google, see what comes up, and, kind of take it from there. And I think that's kind of the exciting part of these kind of learning experiences, especially while we're in, this time in our lives where we can, explore anything and everything. And
correct that and say that you can explore anything and everything at any time in your life. Colonel Sanders started his, fried chicken company in retirement.
Wow, no.
There's always time.
There's always time, for sure. But yeah, I mean, I just encourage everyone to take advantage of, despite being home, being separated from others, but it's really this vault that, you can unlock and find so many different opportunities and avenues to, explore your interests in healthcare, for sure.
And I would also say, like, don't be afraid to, like, not take advantage of an opportunity just because you don't feel like you fit the description. Like, obviously, the title of my position was digital health intern. And I mean, I've never done anything code related in my life. But realizing, like, that passion's there and you understanding what the company's actually, like, what they're actually doing and trying to accomplish. And if you are passionate about it, you're always going to be able to learn something. So I think that was the biggest thing too, is don't be afraid just because you're uncomfortable, but you are passionate about about advanced care planning, to like take advantage of an opportunity, because you can learn the skills that come with it too. So.
Definitely. And one last question that a student kind of submitted was, how can palliative care education or, advanced care planning education teach, healthcare students, whether those be, future medical students, consultants, tech designers, et cetera, about the importance of, patient-oriented care. I know we've touched on this a bit, but maybe if we can, do a quick recap on that.
Yeah, I mean, I think, and Alyssa, I think you have a very good perspective on patient-oriented care, so I definitely want you to chime in on this. But the way I view it is, pretend that you're accompanying your grandmother to the doctor. How would you want her spoken to? How would you want to speak to your grandmother if you were her doctor, right? And I completely understand and 100% recognize that being a physician is time consuming and it's exhausting, right? But how can you adjust for that, right? One of the things we do at Koda is we leverage the anonymity of technology so that people can go through a lot of this conversational process on their own or with their families without sort of the cultural biases of interacting with your doctor, right? Or the authority bias that comes with that. And then have the doctor come in at the end and just clarify questions and really streamline the discussion and go through it relatively quickly. But a professor once told me this, right? Anything that's worth doing is worth doing poorly, right? It's the exact opposite of what my piano teacher taught me, which is anything worth practicing is worth practicing perfectly, right? And that being said, like, you don't have to be perfect to engage, right? You just have to start. And having even, you know, a foot in the door makes more impact than not doing anything at all.
Yeah, I would agree. I think that also learning about advanced care planning and like patient centeredness, I think it really opened my eyes to like vulnerability and patient vulnerability, especially with those who cannot communicate for themselves. And then, I mean, with what I'm doing with the language barrier, I think that, and those who just don't have enough access to the resources, it really teaches you like what patient centeredness means for any patient in that. So I think that really opened my eyes as well to the health disparities and like the social determinants of health and why we need to switch this upstream care. And I think that's where we come in. So.
Yep, agreed.
No, I definitely agree. I think we are kind of amidst this shift more towards, value-based care. And I think adding this component of, introducing advanced care planning, palliative care education is a perfect complement, within that shift, especially for students. I think it really just does emphasize, caring for other people and really taking the time to connect, understand, people's, limitations, people's comforts, discomforts. And I think that's extremely important, for, medical students or any, healthcare related student to understand upon, entering that field, for sure.
For palliative care particularly, access to palliative care actually improves treatment outcomes. Your likelihood of getting better and, getting to remission for certain types of cancer, for example, is affected by your access to palliative care, because I think most people hear palliative and they think end of life. Palliative just means symptom management, right? And when people's symptoms are managed and they live better, more comfortable lives, they have more energy to respond to treatment, right? They have more energy to be able to withstand really aggressive treatments. And so when we deny people access to those sorts of things, whether through education or socioeconomic status or communication or language barriers, we're literally denying them care. We're denying them the possibility of a cure, right? So it's not just an end of life component. We need to make this accessible to everyone because it's access to healthcare throughout.
No, definitely. I just wanted to, while we're kind of reaching the end of our time, for this conversation, I just wanted to, take the opportunity again to, thank the two of you for engaging in this, important subject with us, and, one that's really far from over, in terms of discussion and really prompting student involvement in. And, I'd encourage, students who do watch this, recording to, continue this conversation on student engagement and involvement, seek out opportunities in this field, because there's so many available to us. We just kind of have to, look for them or tap into our own networks to really, find our space in this kind of aspect of healthcare. So, just to wrap up, I just want to thank you, everyone, and of course, Tatiana and Alyssa, for your participation and time in this. It's an extremely important, topic of conversation, and I was really happy to, kick off this with the two of you.
Wonderful. Yeah. Thanks so much, Sabreen.
Of course, thank you.